Good morning. It is Monday, July 26th. I'm Jessica Lovell. Welcome into the Morning Medical Update. Glad you're joining us. Today, we are focusing more on the rising COVID numbers and the impact on the upcoming school year. A lot of questions surrounding that. But first, as always, let's get straight to our COVID count. Dr. Nathan Barr is joining us, in for Dr. Dana Hawkinson with the latest numbers from the weekend. Good morning, Dr. Barr. How are you?
Good morning. Doing okay. We have still quite a busy hospital with lots of COVID cases. And unfortunately, a lot of sick people. So today we have 34 active infections this morning, 16 of those needing the ICU, and 9 of those ICU patients are requiring ventilators to help them. So that's really a high proportion of very, very sick people in our hospital. We also have additional 22 folks that are considered out of that range of active infection but are still requiring hospitalization. So a total of 56 hospitalized patients related to COVID right now. And in Hays we have 2 inpatients, and 1 of those is requiring mechanical ventilation as well. So lots of sick people.
All right, Dr. Barr, thank you for the update. Do we have any reporter questions on the line today?
Sure. Good morning. Cody Holyoke with Channel 9.
Good morning, Cody.
Hey, good morning. Looking at the numbers, as there's at least an attempt to have a big vaccination push around the country, the White House said about 780,000 vaccine doses were given just in a 24-hour period over the weekend. That was the most in 3 weeks. 7-day average of new vaccinations, I think, up 28%. Your thoughts on that? But I'm also curious, I mean, best case scenario, if they're getting the J&J vaccine, the clock starts for 2 weeks this weekend. So what are your concerns in the interim before people technically become fully vaccinated?
Well, hopefully the folks that are getting those vaccines are also realizing that it isn't, a free pass to, hang out in a crowd of 100 without masks in the meantime, right? So we hope that, masking and distancing and things like that are part of that calculation as well. But there is that window period where there could be, could still be infection, and we hope all the folks are getting counseled on that and realize that. But very excited to see vaccine numbers going up. I mean, I think the same things we've been talking about for a while, the higher number of infections, the sick folks, I would imagine they're making folks that haven't been vaccinated consider whether or not they want to go ahead, and I'm glad to see there's more people getting vaccinated.
Hey, Cody, I want Dr. Barbara Pahud to also weigh in on that as well.
So I think it's important to remember, you just mentioned the J&J vaccine and how we're going to have to wait at least 2 weeks, 3 weeks for it to kick in. But don't forget that most of the other vaccine doses require 2 shots and that you're not fully protected and you've had both of them. So that's really a lot more time out before you're fully protected. So please do not have a false sense of security that 1 dose means you're cleared to go out and go to gatherings, visit families, still continue to wear your mask, because we have seen patients in the hospital a week after their vaccine saying, but I got vaccinated a week ago. That's not enough time to protect you. So please continue to take care of yourself, avoid gatherings, wear your mask until the vaccine has really kicked in.
Other questions?
We do have one here from Channel 5 with Carolyn Cruz, and it is for Dr. Pahud. She wants to know, a viewer had messaged that Children's Mercy Pediatric ICU is officially on triage status. They say it means more children are requiring ICU level care than there are beds and staff. Is that accurate?
Absolutely accurate. We've been busier than we have in a very long time. Our hospital is to capacity. We get emails every day with whenever the hospital is to capacity called high alert, high census. We've been getting that pretty much every day. I haven't gotten the one from today, but the whole weekend and last week it has been. I go on call tomorrow, so I'll let you know, but it has been pretty busy. And I would like to give you all a quick image. I'm more of a visual person. Do you remember in the times of COVID in the times of polio, when we remember those pictures of the iron lungs, kids and adults in the iron lungs, gyms full of iron lungs? We don't see those iron lungs because now we use ventilators. But I wish we could somehow give people an image of all these people on ventilators, which is the equivalent of iron lungs back then. We are having the same problem we had with polio, with people requiring ventilation and running out of ventilators. So it's time for people to really go out and get vaccinated, and it looks like it's happening. So I'm very encouraged by the numbers. I hope it's not a blip. But if it's a blip and people lower their guard, it's a problem. So let's keep this up.
And just to clarify, Dr. Pahud, are you full because of COVID patients, or are you full just because you're full?
We're full because two things have happened. We do have more COVID cases, obviously, in the younger population that is not able to get vaccinated. But also, when we decided to lift the mask policies because we have now vaccines available, in addition to COVID being able to spread, all these other childhood diseases can start spreading as well. So we are starting to see RSV virus, for example, which is a virus that normally only circulates in the winter. We're seeing it now. And all the respiratory viruses that we didn't see for a year while we were in quarantine, we're seeing now. So we're having a very abnormal summer with winter and summer viruses combined, and kids and adults alike are landing in the hospital because the world is open again, and that means infectious diseases, not just COVID, are circulating.
Other questions? I do have one from KCTV5. The question is whether the mask mandates or bringing them back could hurt the campaign to get more people vaccinated. It would seem to me that it would be a bad idea to bring back a mask mandate while you are trying to promote vaccine. The bottom line is once people get vaccinated, it's over, right? It seems like doing both could backfire. But again, I'm not the expert, but you are. Your thoughts?
So it could backfire from a political perspective if people don't want to wear a mask, but remember, we are in it to save lives. So if it backfires because people think, well, if I got my vaccine, why do I need to wear a mask? We just discussed it. It takes a while for the vaccine to kick in. You need to give it enough time. So in the meantime, and while we're seeing this uptick in cases of everything, not just COVID, it's important to continue to wear a mask. So I know that it's not a popular choice, but it's the right choice to save lives. So that's what we have to do.
Dr. Barr?
Yeah, I would just add, I think the other thing we've seen is, when we've given guidance that's a bit nuanced, like, well, if you're vaccinated, you don't need to wear masks, but if you aren't vaccinated, please would you wear masks? That's not working. It's clearly not working. We're seeing widespread COVID, and I think a good chunk of that is probably related to folks just not wearing masks regardless of vaccine status. So I'm not worried about, to be perfectly honest, I'm not worried about, a downside to mask mandate. I'm worried about people dying in the meantime. And so I think it's a very, very good idea. I hope it happens today. Today's a good day.
Good day. I like that. Okay, so we want our community, of course, to start sending in their questions. Jill's going to grab those offline for you. And then, Dr. Barr, we're going to get back with you here in just a few moments. But I want to just reintroduce Dr. Pahud to you, Research Director of Pediatrics Infectious Diseases at Children's Mercy. She's going to be answering questions today. And also, so glad to be joined by Dr. Kenny Southwick. He is the Executive Director of Cooperating School Districts of Greater Kansas City. Dr. Southwick, welcome. Thank you for joining us. You've been talking with 32 local districts, including rural, suburban, urban communities in 13 Missouri counties, also Kansas districts here in the metro. So is everyone on the same page regarding COVID safety this fall?
It all depends on what you're talking about. Through all of COVID, as you know, the guidelines have come down from the CDC and from the two states that we operate in, Kansas and Nebraska, and then all the local health agencies in the counties and the cities. There's been a lot of mixed messages through all of COVID, and that continues. As we move forward, there's a couple of things that we definitely are on base for. That is, we're going to have in-person learning. There will be some opportunity for some virtual learning if parents choose that, but by and large, the majority of our kids are going to be back in school in person. So that's the number one. The second is, all of us believe that the way for us to ensure that students' lives won't be interrupted and teachers' lives won't be interrupted and parents' lives won't be interrupted is to get the vaccination. So we're on the same page with respect to that. That's pretty much where it stops. July the 9th, CDC gave recommendations to schools. After that, we got a short guidance from the state of Missouri, and then they updated that on Friday in a synopsis, and that's available out on their website, missouri.gov/DESE. Basically, the questions really become around what will the county guidance be as it comes down. and what will the city or local guidance be, and then what will community response be. So right now, all of our school districts are trying to look at the data, trying to make recommendations about what we know about COVID, what we know about wearing masks, social distancing, getting the vaccine, contact tracing, testing, all of those things, and deciding what their policies are going to be for when school opens. Having said that, July 9th, when the CDC sent their recommendations out, things have changed dramatically even since July 9th. So a lot of our school districts are out there continuing to look at the data as long as they possibly can before they have to make a communication to parents. Some of those have started having meetings. I know last week, I think Blue Valley and Olathe have made some decisions. And tonight, I know Shawnee Mission has a meeting. And a lot of our school districts in the metro area will having these discussions as the board meetings come about. So decisions still to be made. But one thing about it, we wanted since day one to have schools back in session in person. We're closer to that, but we're not where we thought we were going to be at the beginning of the summer.
Yes, changing week to week for sure. So do you know if schools will be asking or even able to ask if eligible children or teachers are vaccinated?
This point in time, districts that I've talked to are not going to make it a requirement for them to say whether they've been vaccinated or not. Obviously, if we get into situations of cases in classrooms or in schools where we would need to have isolation for those infected or for those that would maybe need to be quarantined, questions would be asked. Parents could come forward, could give us those recommendations. At this point in time, the guidance is not to recommend mandate. That would be a nice thing if we could do that because we mandate other vaccines. But at this point in time, the schools aren't doing that, and we're not even sure that there's legal basis for us to do that. All of that with the rising numbers could change, which is what makes it more and more difficult to make these decisions.
So we've heard in the news these summer camps that have seemed to be super spreader events with young kids. Do you think this might be a precursor to the fall?
So as we go back to school, the quick answer is, yeah, I think it could be. I don't have any idea of what, in terms of mitigation of what kinds of procedures they had in place or if they had procedures. I'm assuming they did, but I don't know that for sure. I know we learned last spring there were ways for us to keep kids safe. Some of that was through social distancing and still having large numbers of our kids on virtual. But I can tell you, when the mask mandate lifted, pretty much the mask went away in school. And where we are right now in terms of numbers, all of our districts are revisiting that, looking at whether either all of their students or some of their students, primarily elementary, might need to go to a mandate. I think all of our districts are going to highly or strongly recommend that masks be worn for their staff. But it'll be a decision that they'll have to make. And as we learned last year, we're pretty good at pivoting. And if we need to pivot and change our policies and practice to keep kids safe, we'll do that.
Yeah, I'm sure they learned a lot from last year. Okay, so just last question, though. So, Doctor, what do districts tell you that they need from the parents in light of the vaccination rates and, of course, this wide range of guidelines? What do parents need to be doing to help out? Did you hear the question?
I'm sorry.
That was for you, Dr. Southwick. Just asking what what are you hearing from districts? Yeah.
I think parents want information. They want to know how to prepare to get ready to send their kids back to school, and they want to make sure that they're going to be safe. Again, with the mixed messaging and quite honestly, a lot of the false information out there related to vaccines, it can be difficult for the parents to get the information that they need. But right now, they just kind of want to know what to expect, knowing that once those decisions are made, not everybody's going to be happy. And we know that. We're not in a business where everybody will be happy. But but trying to look and focus on the data and what it'll take to keep kids safe. I would like to say this before before we leave this, and that is that this is the time of year when parents are contacting health departments or contacting their doctors to get their kids vaccinated on the mandatory vaccinations they need to be in school without some kind of an exemption, medical or religious. So this is the time when they do that. You guys have already talked about the importance of the delay between when they get the vaccine and when they're really going to be safe. We're in that window. We're about a month away from school starting in most schools. So right now, parents, my message would be, if you are going to get your child vaccinated, don't wait till the last minute like you sometimes do with other vaccines. Now is the window of time to get your children vaccinated so they can go back to school and have the greatest opportunity to be safe and stay in school.
Great point. Dr. Pahud, you listened to these challenges from Dr. Southwick. What advice do you have for parents as they head back?
Well, I think one quick update is the Moderna vaccine got approval in Europe, but we in the United States right now only have the Pfizer vaccine. So if you want your children protected before school starts, I agree that this is our time to do it, but you're honestly a little bit behind because the vaccine requires 21 days in between doses and the Pfizer vaccine is 2 doses. So you better go and get it as soon as possible so that your child can be protected before going back to school. Second thing is, I don't know how else to say this, but it's kind of sad, in my opinion, to see that we, of course, want to put a priority into the economy, reopening everything, restaurants, everywhere you go right now around the city, everything's open, no masks are required. But when we're talking about children and knowing what's the right thing for them and how to bring them back to school, we really push back on the masks. But it's important for us to keep the kids in school. So whether it's vaccination, masking, whatever's necessary to put the kids back into school, I think that's what we need to do. It's important. And if that means that our community needs to step up and mask again to allow the kids to go back to school, I would absolutely be in favor of that. Now, of course, I'm biased. I'm a pediatrician, but I want what's best for the kids. And I think that our economy could continue to thrive if we just all mask up and go back to our regular lives. But vaccination, masking, continue doing that.
All right, I'm glad you're here for this next question because it's right up your alley. The U.S. Surgeon General recently issued a public advisory warning about COVID misinformation. In the advisory, they said 67% of unvaccinated adults had heard at least one vaccine myth and believe it or considered it to be true. Are you seeing this? What is your message? Is this in your work, people you interact with? How do we address that big problem?
It's a big problem. I personally get about 4 to 5 phone calls a day or emails from close friends and family, not just the community. If I added the community, it would be a lot more than that, with personal questions about misinformation. So the thing is, you need to remember that social media really has the skill set to target the person that is scrolling. So if you have Facebook, Instagram, whichever social media channel you use, they know who you are. Like, they know if you're a white male in your 40s or a 20-year-old female, and they're going to target the fear to meet your needs. So if you're a 40-year-old male, they're not going to talk to you about infertility. They're going to be blasting about other things. And each person that calls me happens to have heard of the issue that has been targeting that age group. So I've spent a lot of time trying to address all these misinformations, the infertility questions, which of course is not true that the vaccine causes infertility. We have over a year of data now out. And I want to remind everybody that this is the first time in the world that we'd had a vaccine that is about to get approved by the FDA with over 3 billion with a B doses administered worldwide. We have more vaccine safety information on this vaccine than any other vaccine ever in the history of the world. And we have been transparent about the side effects that we see, as you have seen it played out in the TV. When we knew about anaphylaxis, we told you about it. When we knew about the clotting events, we told you about it. The risks are small compared to other things that you go about in life. You're more at risk of getting hit by lightning or having a car crash or any other event in your life than having a serious adverse event from the reaction from the vaccine. So again, we've been transparent. The vaccine safety is good. Getting the vaccine is the best option.
I want you to comment on just a couple more things, then we're going to get to community questions here in just a moment. But so this misinformation, as you can imagine, very polarizing among family members. What is your comment on that? What advice would you have regarding that?
So I think we have to be kind to one another. We all love to get into a big fight, especially after the past 4 years political climate. We have gotten used to fight with each other, and we need to really back away from that. I can have a discussion with my friends and with my family members who don't want to get vaccinated and still love the human more than their beliefs. So what we need to have is some tolerance with each other, be able to give people the correct information so they can make the decision that's right for them. Now, obviously, I believe the right decision for everybody is to get the vaccine, but you cannot force anybody to do anything. It's like when you want to convince somebody to go exercise. You can tell them all you want, but until their switch goes off, because they understand the importance of it, they're not going to do it. So the best thing you can do is continue to have an open channel, conversation with your family members and friends that have not been vaccinated, and guide them to the right resources so they can make an informed decision that comes from their own decision making, not from bullying.
Right. One of our viewers, Sally, sent this in to me. She wanted me to get this article in front of you with this headline to just see what you had to say about it. It's from the New York Times. It says, children are no longer hidden victims. They are dying of this disease. The article is referring to the hundreds of kids and deaths in Indonesia. But how can we relate that back here to the U.S. and our kids?
We are going to see problems. And I am telling you, you asked this earlier about summer camps have been super spreader events. Are we going to see this in the fall? And the answer really is up to us. If we open schools up without social distancing, without vaccination, without masks, we are going to see problems. We're going to see children land in the hospital, and that's the last thing that we want to do. This is now a vaccine-preventable disease, so my hope would be that kids are protected if they don't have a vaccine available to them yet, through social distancing, through vaccination of their family members, and masking. So we can avoid it if we just go back to school the way that we did it last year in the schools that came back and did it successfully. We know how to do it. We just have to get over our fear of sending our kids to school with masks and just let them do it.
But do you get concerned that last year one of the big headlines was this doesn't really affect kids? Kids don't really have symptoms. They don't really spread it. Now we're kind of shifting that.
Yes.
How do we kind of change that mindset?
And we're shifting that because, again, about 50% of Americans who are vaccinated now are no longer going to get the disease. And most of the people that lined up right away to get the vaccine are people at high risk of COVID. So elderly people had priority for the vaccination, right? And we included them in the clinical trials. So you're not going to see as many deaths now as we did early on in older people because they're mostly vaccinated. It's shifted now to the unvaccinated, and the unvaccinated are younger children who can't get it, or younger adults who choose not to get it at the moment. So that's why we're seeing this shift. It's not that the disease has really changed that much, it's that the pool of people that is susceptible has changed, so they're the ones that are getting it now.
One of our viewers, Tanya, said she loves how Dr. Pahud keeps it real. So thank you for doing that. We appreciate that. On that note, let's get to all of your questions out there in the community. Jill, get us started. Good morning.
All right. Beth wants to know, what do you say to neighbors and friends who believe masks are dangerous due to CO2?
That's not true. I'll try to copy you and keep it real, Dr. Pahud.
Yeah, please do.
So, I mean, that's the very basic part of it, is that's been proven not to be true. There's been a lot of, I guess, misinformation and rumors about that, and it's very clearly not the case. If masks were causing CO2 buildup, think about all the healthcare workers that would have been passing out in operating rooms in 8-hour surgeries. There's some very practical things we can think about with this that show you it's not true, but it's also been studied and is not true as well. So I think the very basic way to answer that is, well, there's very good evidence that that's not the case.
I think the reality is we just don't like to wear them.
Yeah.
And because we don't like to wear them, we want to find a medical reason to say I can't wear them because it's going to cause some problem in my head because I have too much CO2. But again, think about it. You rely on the surgeons to have surgery, to do your surgery. I just had surgery a month ago. Do you think I would have let a guy cut me if I thought his brain was going to be affected because he was wearing a mask? No, absolutely not. And we've been doing that for many times. And I mean, even like transplants are 12 hours, 14 hours, right? They're wearing masks because we're trying to protect you. And the person that wears a mask is the surgeon, not you. So the surgeon is the one that can give you the disease. Think about this too. It's not the patient that's wearing the mask. It's the surgeon. So we are trying to protect the patient by wearing the mask, and the surgeons have perfect capacity to operate on you with a mask on. Number two, if you go to Asia, they wear masks routinely. This is just part of what they do. Before it was cool to wear masks in the United States, they've been doing it, and it helps them decrease the spread of disease. And honestly, I am going to continue to wear masks when I travel internationally, because the bad news is this is not the last pandemic we're going to live through. It's going to continue to happen. This is one of many. Get used to it. We got to learn how to wear these masks and get comfortable with them. Kids are doing it really well. Now it's time for us to do it too.
Amen, sister, to that. Our families decide, we're tired of getting sick when you go on vacation. You get on the airplane, you're so excited, you arrive to your destination, and then somebody gets sick. So we've all said we're wearing masks from this point forward. Magda wants to know, can you test someone to find out if they had COVID and were asymptomatic previously? Is there a way to distinguish between antibodies from the test versus the illness?
There is, there's different types of antibody testing available. There's the spike protein is really what we find that it can be from if you've had the disease, but it can also be from vaccination. But this nucleocapsid antibody is the name of it. If you look for that antibody, that's not from the vaccine. So that's the way that it can be done, but I would caution that there are a lot of different antibody tests out there. You clearly have to know the target, and the different antibody tests have different types of performance characteristics. So there's a bit to that, and it's not quite so simple as get the test, see plus or minus, and go with it. You definitely need to, if you're going to do it in conjunction with healthcare provider and talk through what that means with them.
And I think my quick summary is why, because I want you to get vaccinated anyway. So why do you want to know if you're asymptomatic or not? If you were symptomatic and you were tested and you were positive, you know you had it. If you're asymptomatic and you were not tested, you need the vaccine anyway. So why get a blood draw when you can just go get the vaccine?
Stephen wants to know, non-maskers seem convinced that COVID is not a serious risk to children. Is that true?
Well, how about you talk to the parents of children that now have permanent heart damage, or kids that have been in the hospital intubated and are equivalent iron lung of today, and ask them how mild that was. So it's easy to say it's not important when your child has had an asymptomatic infection. That's great. But you never know if your child is going to be the one that has serious disease or not. So I think we need to do this because it's random. It's just like car seats and seat belts in a car. You don't know if you're going to be the one that has a mild car accident or a serious one. So everybody has to do the right thing. Everybody needs to not drink and drive. Everybody needs to stay off their cell phone, because we're all trying to protect each other.
Sarah wants to know if the Delta variant is affecting children differently than the Alpha variant, and is the Delta variant transmissible through a mask?
Well, so it's not transmissible through the mask. There's no difference with this from the prior variants in terms of mass transmission. Masks are very good at protecting, and so there's no difference there. Perhaps I should defer to my pediatric colleague here about how it affects kids exactly.
Yeah, I just thought it'd be good for you both hear from both of us that the transmission is the same. The virus does not discriminate which type of mask you're using. As long as you wear a mask, that's really what helps, just the protection, because it basically lets the all the respiratory airflow from our mouth is going to be covered by the mask. And you guys did a special here with a video that maybe you guys should circulate that again, where you can show, you know, in a cold room how your breath shows, and with a mask it just doesn't show. So that's why mask works no matter which variant it is. Now regarding children, the Delta variant is affecting more children, but not because it has a special predisposition for children. Again, because children remain unvaccinated and we opened up the world again. So since the world is open again and children are out in summer camps and hanging out and having parties, they're transmitting the virus to each other. A year ago, when we had the other variants, kids were at home and they were not going to school. And if they went anywhere, they went with a mask. And now we've just reopened the world and forgot about the kids. So that's why they're getting more disease.
Should parents be testing their kids more? My kid had runny nose, some weird symptoms that she hadn't had in a while. I'm thinking about actually having her tested today. should parents start just testing more like they used to?
Yeah, so this is my humble personal opinion. I would love to hear what you think, but if your child has a runny nose and is doing fine otherwise, it doesn't really matter if it was COVID or not. You're going to manage your kid the way that you would manage your kid 2 years ago. That's what I really want you to think. Even if we're afraid of COVID, if you normally would go to the hospital because your kid has a fever and you're worried, go. If 2 years ago your kid had a runny nose and you would have just ignored it, ignore it. Because it doesn't matter if it's COVID or not. Again, COVID can be serious or it may not. Same thing as influenza and all the other viruses that we take care of. So you need to use your parent gut feeling of, is this something I can handle at home, or do I need to go to the doctor or the emergency room? The testing, again, I don't care, because if your kid is positive but the vaccine becomes available and they had mild symptoms, I'm going to ask you to get them vaccinated anyways.
Of course, yeah.
I think where it perhaps does affect things, I totally agree with your point. I'd say where it does perhaps affects things is if you know you have a kid and you they have some mild symptoms, but you get them tested, that's, you know, and they're positive, you got to keep them away from people. Now,
right.
Perhaps you should be doing that regardless, you know, if it's RSV or another virus as well. But, you know, remember, the kids, you know, if they get it, they can spread it to you, and they can spread it to other kids if they're in a daycare or a school. They can spread it to, you know, teachers, things like that, if nobody's wearing masks. So that's a reason to think about getting tested. But, you know, remember, testing isn't foolproof. It isn't, you know, 100%, but I would consider it for that reason. I totally agree. I would not do it if you're thinking, well, if I get it, I don't need a vaccine. I think that's a sort of logic I wouldn't go with. But it may help you in considering what to do in terms of keeping them away from other folks.
Yeah, 2 years ago I would have ignored it, but
Yeah.
I might not now. That's
And
for
also,
sure.
2 years ago, if a child had a fever, some parents would sneak them into school with Tylenol, right? I hope you all know now that's not cool, not just because of COVID, but because of flu and everything else. So my wish, which I know is not going to happen, but my wish would be that if your kid is sick, I don't care what the reason for it is, but you would keep them at home and not go to the doctor. Keep them at home regardless of what that is, right? You can't just be like, well, it's not COVID, then I will send them to camp. No, it still could be flu, it still could be RSV or paraflu, and you want to protect others from any virus, not just COVID. So I would hope that parents are a little bit more mindful now that we've had this pandemic and continue to avoid spreading any disease, not just COVID, to other people.
I hope and I think this is driving this home, not just to parents, but our population in general. The whole, you know, I'm going to be tough and go to work even though I'm sick is probably not a good idea. It is not a good idea. It is getting your coworkers sick. And I think that's sort of a cultural thing. We sort of do have that instinct where, no, I'm okay. I want to go to work. And I think that's a bad idea, and it probably is. You know, I think we can all remember respiratory viruses spreading around the office. That's not a good thing.
Yeah. And even now, when we don't yet have a vaccine mandate back again, if you have a runny nose, a cold, a cough, either stay in, or if you go out, wear a mask. You don't need a mandate to tell you what's the right thing to do. And it will significantly decrease the spread of diseases, and we could affect other things, not just COVID, influenza, many other things. So,
Dr. Southwick, can you jump in on this?
Yeah, I can. I've got a question for the doctors, and I've heard some people that make excuses go, well, these vaccines were rushed, and these vaccines are only approved for emergency use. We know those are going to come off. My question is really kind of twofold. What's kind of the timelines for when we think those will come off for our school-age kids that are eligible right now? And I think Children's Mercy right now was involved in the nationwide study in terms of vaccines for younger children. And what are your predictions that maybe be able to share for parents of when we continue to get kids vaccinated, when we'll be off this emergency use for the older kids, and even if we're on emergency use for the young ones, when that might be?
So I think the emergency use authorization is going to come up first in adults, because that's the first vaccine that got approved, of course. And I know that there's conversations about hopefully getting full FDA approval sometime this year, as early as maybe September. Now, the hope is that, but of course there's again, billions of doses of data available for the FDA to review, which will make both their job easier in proving that the vaccine is safe and harder in reviewing billions of doses of data and getting it approved in time. Remember, past vaccines had clinical trials of 30, 40,000 people, and that's all the FDA had to review. Now that we have a EUA, Emergency Use Authorization, the vaccine has been given to, again, billions of people, and so there's a lot more data to go through. Now, for the children, we are doing the pediatric clinical trial at Children's Mercy. We are currently enrolling the less than 5, so 6 months through 5 years old at Children's Mercy. The older age group, 5 to 12, has closed. This is basically the last week that we're enrolling. We are to capacity. We have all the patients that we need. We don't need any more. Thank you, everybody, for volunteering. And that means hopefully we will get the second dose to these participants that are getting vaccinated this week, 3 weeks from now. After that, we need 2 months. So we're going to be September, October, mid-October by the time we finish gathering all the data, which means a submission to the FDA could probably be coming as early as November and approval with the emergency use authorization at the earliest at the end of the year. So children should not expect to be vaccinated before school entry. Maybe they'll be able to get it for the 5 to 12, but the little ones are definitely not. So I think we need to be prepared for parents not wanting to get the vaccine to kids due to the EUA. So go back with the masks. Those that can get the vaccine, great, but most will not be able to until next year.
So they'll start in the middle, possibly start this in the middle of the school year getting vaccinated.
Yes.
Dr. Southwick, do you know, will the schools be able to participate in that and be sites for being able to administer the vaccine? Do we know that?
We have offered, different school systems have offered opportunity for sites to try to make it convenient, although I will tell you that not a lot of our students have shown up to do that, but we're going to continue to work on all kinds of things. Whenever we've got vaccinations that are available, then we're going to work either with our local agencies or in our own systems to get those vaccines in the arms of our students. That's really the only way we're going to get school back completely to normal, unmasked, not social distancing and everything else. We've got to get kids vaccinated.
Trista wants to know, Dr. Southwick, if the schools are going to have rapid tests available.
So the state of Missouri worked last year to provide tests for school districts. And one of the problems we had with that is that students were supposed to show symptoms before we gave the test. And we didn't want them in school, so we had to look for alternative sites. There are dollars that are available for COVID mitigation for school districts. It varies on the size based upon the amount of money they've received. But a lot of our school districts are continuing to look at what they can do for contact tracing and what they can do for testing. Again, that's all part of the mitigation process. It's not just one thing. It's all of these things together that give us the greatest chance to keep our kids healthy, our teachers healthy, and the educational process moving forward.
Sandy wants to know how the summer school programs did since they lifted the masks. Have you seen an increase in COVID cases, or do you know?
Well, we hadn't, and part of the reason is most of the summer school programs in the area start as soon as school's out, and they're done before the end of June. And at the end of June, as you know, the uptick really hadn't started yet. So those students that were in school, and there were reduced numbers in summer school, not all of our students go, so it was a greater opportunity to social distance and that. Some of our districts had students wear masks, some of them didn't, but we didn't have any large numbers reported. That's likely to be different now if we looked at programming in August versus programming that ended in June.
All right, so I think we have time for maybe 2 or 3 questions, Jess, and then we're going to call this, although we have a ton of questions. One of them is whether Dr. Pahud would come back every week until we get into school. So be thinking about that, Dr. Pahud, and if you think you have bandwidth for that. But Kathy wants to know, after having a conversation over the weekend, she wants to know, is there a test that tells if it's a Delta variant or not?
Well, I would just assume it's Delta variant if you have a positive test at this point. I think that's the easiest thing to do. There are tests that will do this, but they're not tests that you're going to be able to get readily available. These are, these are more technical lab tests to decipher what's just going on. So yeah, that's tests to be done, but I think the truth is, if you have a positive COVID test now, I would assume it's Delta variant.
And Pat asks, can you be vaccinated, asymptomatic, and spread the virus?
Yeah, I think the answer is yes. Now, the risks are going to be less. So if you're unvaccinated, you're more likely to get sick from it. Hospitalized, you're more likely to die from it. You're also more likely to be able to spread disease. And that's because you're going to have bigger numbers of the virus, essentially. If you're vaccinated, you're less likely to have any of that happen. If you have a really good functioning immune system, you're very unlikely for any of that very sick illness to happen. However, you can still contract the virus and you can still spread it potentially. Now, I would say you're less likely to spread it just because you're going to be less sick, having less virus. But exactly how to quantify that, I can't do that exactly. So can you? Yes, but the truth is, wow, the benefits are so much more than that. I think what the message should be is not, oh, well, I can get it, so who cares? No, you can get it, and then you can, recover very well and not have to be hospitalized or die or something awful like that. And you can also very likely have much less risk of spreading it to somebody. So there's many reasons to vaccinate, but vaccination is not sort of a carte blanche to do whatever you want and, I don't know, go close breathing up to everybody you meet or something like that.
And last question, Nancy wants to know, how do we know for sure that these vaccines aren't going to have long-term side effects in children?
So the short answer is we have experience with vaccines. We've been doing this for over 100 years now. There's many other vaccines that are out. And we have followed these vaccines and the long-term implications of vaccination. So the vaccines that have long-term problems are more the live vaccines that could potentially come back. So for example, the polio vaccine, which was live, can come back and cause real disease. So that's why we moved in the United States to stop giving that vaccine and instead are giving now an inactivated vaccine. Now, these messenger RNA vaccines and the adenovirus vaccines don't have any live virus in them, so those complications are simply impossible. So from our experience with all the vaccine work that has happened since the beginning of vaccinations, we've never seen long-term consequences with vaccines. What we do know is side effects and serious adverse reactions from vaccination occur in the first 2 to 3 weeks after vaccination, which is why we always monitor very closely that month after you've gotten your vaccine, and why the FDA extends that to 2 months of safety data. But you know this from, again, 3 billion doses given, that anaphylaxis happens within 24 hours and is treatable. The clotting event happened between 1 to 2 weeks afterwards, and now that we know about it, we can decrease the chances of you getting it by avoiding giving it to population at high risk. And then the myopericarditis in children, also manageable, treatable, also presented within a week to 2 after vaccination. So we don't have any concerns about long-term side effects, and we have experience looking at this data from past vaccines.
Where we do have concerns about long-term effects is from COVID, right?
There we go.
So if you're worried about long-term effects, COVID is the thing to be worried about, not the vaccinations.
And the amount of long-term side effects from COVID remain to be described. There's a lot of neurological side effects that we're seeing. Your nerves in your nose get affected. As you know, some people can't smell for a little bit, but some people have not been able to get their sense of smell back. And there's other, like the fog that people describe, the long haulers. These problems, we still don't have an answer to them, and they are real, they're well described, and we know about them. So again, put the real risk of what we know from COVID versus the maybe I believe potentially I make up a side effect down the road from the vaccines, which we have never seen in any other vaccine. So the data for you is right there.
Great info, great insight from our guest today. We really appreciate it. I want to get to our final thoughts, and Dr. Barr, I'm going to start with you.
Okay. Well, let's see. Since I'm an adult doctor, and maybe I'll focus there. We have plenty of experts regarding how this affects kids, but I would just keep saying we have a lot of sick patients in our hospital. we need to do as a community, we need to look at it not just in ourselves, although vaccines in this case are going to very, very well protect ourselves, but they're also going to help us protect others. And there are those in our community that we love, care about, or maybe have never met that are going to be vulnerable. And whether that's because they're kids or they have an immune system that can simply not mount the robust response we would like from a vaccine, we have a duty as a community to try to protect everyone. So I would encourage everybody, if you haven't been vaccinated, think about that vaccine through that lens, and think about it as perhaps a duty you can do to your community to try to help keep other people safe.
All right, Dr. Southwick, thank you so much for being with us today. Just your final thoughts as we are just a couple of weeks out from school starting.
Yeah, I would just say we're going to be back in school. We're going to continue to look at the information, to make decisions. These are tough decisions. They're not made lightly, and we'll make adjustments as school districts we need to. In the state of Missouri, all of our schools were required to submit a safe return to school plan, and that was approved by the state. So those plans are in place for all of our school districts, but those will be monitored and will be changed along the way. My last thoughts are vaccination. And our best hope is to prevent this disease, not only in our schools and in our communities, by vaccination. We've got to cut through the misinformation. We've got to get people the information in hand and get everybody vaccinated. And then, I think the doctors would agree. Then we can get back to normal life.
Thank you. Dr. Pahud.
I think the final message for me is I am very happy to hear that there's been an uptick in vaccination. It's sad that it happens following the scare that we get from the Delta variant and the uptick in cases. I wish we didn't have to wait for people to get hospitalized and for us to be to capacity for people to react. And that you should just trust your healthcare providers and doctors who tell you this is serious, please go back, get vaccinated. But unfortunately, if that's what it takes for us to get vaccinated, to see an uptick in cases, please let's just use this opportunity, get as many people vaccinated as we can, and let's get kids back into school safely, wear their mask, vaccinate.
Thank you. And you'll be back.
I will be back.
I know you got patients to see, but we'll get you back on here very soon. Okay, so my final thought today is from a sign one of our viewers sent in. Have you guys seen this? It says, get over yourself, get vaccinated, and your kids too. Is this hanging outside your house, Dr. Pahud?
No.
It sounds like something that you would say. So yes, get over yourself and get vaccinated. You can find that fence banner on State Line Road between Kansas City, Missouri and Mission Hills, Kansas. So thanks for sending that in. Thank you so much for being with us today. We really appreciate it. Tomorrow, we are back with stories of COVID survivors that are still struggling with symptoms. The long haulers that Dr. Pahud was just talking about. We hear from a long hauler on the COVID divide in her family, and also difficulties she is facing physically, emotionally, and socially still to this day. We'll also share some data regarding ages and top symptoms that we're seeing in our long COVID clinic. So we will be back with that tomorrow. Have a great Monday.